so we're going to start with the great toe. So great toe and second toe are both going to be turned which way for our lateral?
Medial.
Medially. Okay, remember you always want your part closest to the IR. So whichever toe you're doing, whether it's first, second, third, fourth, or fifth. If I'm doing fifth, you're going to turn it closest to the IR for your lateral, so you're going to turn it laterally, right? Great toe, closest to the IR is going to be medially. So for this, I'm going to have my patient turn and lie onto your left side for me. And it's best to get in the habit of just working with however your patient's toe or body part is, correct? So we're going to take your foot and just bring it out here. And once again, I'm going to align my part and my IR. For the lateral toe, where are we centering? Lateral great toe.
The base of the third metatarsal. Oh no.
Her toe is
Toes.
I mean,
Interphalangeal joint, right? Centering to the interphalangeal joint. So notice the way she's laying, she's got her left leg tucked underneath her right leg. So we can either leave it like that and see if we can get her in a true lateral. But if you look at her toe, you can tell I'm obliqued right now, can't you? Mm-hmm. So I'm gonna have to do something different to be able to roll her all the way up. And what's keeping her from being rolled all the way up is that leg underneath there. So whatever's more comfortable for you, either bringing this leg forward or bringing it back. Forward, so you wanna put it over here. Back, okay? That's fine. And then I'm going to go ahead and line up as close as I can that interphalangeal joint to the midline of my IR. Remember, I want long axis of the digit coming down long axis of the IR. No angle on my central ray, coming in perpendicular, still at 40-inch SID. So I've got to separate these other toes away from the great toe. Well, how are we going to do this? Tape and tongue depressors are our best friend. Are we always going to find tongue depressors in the department? Probably not. Okay? So you will have to get creative. You will, 99% of the time, though, you're going to be able to find tape. So, to separate, let's look at this. Would I take the great toe and go back with it? Or would I take it and go this way?
Yeah, that way.
Why?
So it separates it.
So what I'm trying to do is clear, first of all, the interphalangeal joint and the base of that phalanx, that proximal phalanx. Trying to open up that metatarsophalangeal joint as much as I can. So put the tongue depressor in, pull it back, put a piece of tape on the top of it. And tape and gloves are always a lot of fun. Put that right here on the tip of it. Try not to get your glove. And then you're just going to pull it back. Now with toes, one thing you do have to pay attention to is that the toe is not turned upward or downward. It needs to be nice and parallel to the IR. You might have to manipulate it just a little bit. Patient, how are we doing?
Good.
Okay. And then I'm going to take my tube, bring it over, center to that interphalangeal joint. Still not as lateral as much as I'd like. Can you roll your hips a little bit? There you go. It's okay. Just gonna pop it right back in there. Okay. Just trying to separate these other toes from this toe. And then I'm going to collimate down. I want 1 inch on each side. There we go. And marker. We need our right marker. And we can place it right there. Watch your shadow. Make sure it is not in the shadow. Long axis of the digits coming down the long axis of the IR. I'm centered to the edges of the IR. Questions? All right, let's do second digit lateral. So gonna kind of wedge this tongue depressor in between to make the second toe kind of pop out on its own. I think I'm going to just take another piece of tape just because I can see I have a little bit of overlap between that second digit and her great toe. I'm just going to take another piece of tape, put it on the tip of her toe, and just kind of pull that great toe back some more. Okay. Another option, if I don't have tongue depressors, I can just put a piece of tape on the toe and pull it out. Put tape on third, fourth, fifth, pull those back, and great toe and pull it back. Now, coming into what area? Proximal interphalangeal joint for second through fifth digits. Longitudinal line still coming down the toe.